Welcome to this short learning video on what is AuDHD. My name's Catherine Leggett. So first of all, what is different or the same about autism and ADHD? So autistic people often thrive with structured activities and focusing on one task at a time to completion. Whereas those with ADHD often thrive with opportunities to multitask and work spontaneously. Autistic people often thrive when they're methodically working through projects and tasks. Those with ADHD often thrive when working reactively to short-term deadlines or in crisis mode. Autistic people also often thrive with well-planned and well-communicated change. Those with ADHD often relish new situations and experiences. Autistic people often need visual and written, detailed information, providing more additional context to feel really comfortable. Those with ADHD often appreciate verbal and big picture communication and ideas. Autistic people also really appreciate often others communicating in a literal, logical, and measured way. Those with ADHD often really benefit from others communicating in a fast-paced and stimulating way. Autistic people often thrive when they get clarification of details at the start of activities or tasks, and then are able to work independently with autonomy. Those with ADHD often report that they thrive with agreed regular prompts and check-ins to stay on track or re-steer if needed. Autistic people often really appreciate opportunities to use their ability to think in a very detailed way, use their observation skills and their single focus attention. Those with ADHD often report thriving when they have lots of opportunities to hyper-focus on things that they find really interesting. So what's the same, or what are the overlapping characteristics of autism and ADHD? Let's have a look next. So autistic people and ADHDers often thrive if there's no social pressure to interact or communicate in a socially typical or neuronormative way. When they're provided with sensory suitable environments. When others affirm stimming. And when they receive support for vulnerability to poor mental health, and that support is meaningful. When others affirm different, preferred, or needed ways of communicating, for example, written versus visual or verbal communication. When they have meaningful support to express feelings in a really meaningful way. And when there's support and understanding for emotional regulation difficulties. And also support with planning, prioritising and organising everyday activities. So how does AuDHD present? How can you tell if somebody's autistic and ADHD? So these are some examples that are common for people with both autism and ADHD, but there are always exceptions. So they might really benefit from routine, but find it difficult to work in a structured or planned way. They might be interrupting or talking in a fast-paced and spontaneous way, but need others to allow them processing time and not to interrupt their conversational flow whilst making a point. They might persevere on completing interesting or future tasks and perhaps drop priorities. They may have enhanced difficulties regulating their own emotions, but really need others to remain neutral and calm in their expression of feeling or emotion. There may be an enhanced need to perform stimming behaviours to remain focused or calm. And also there may be enhanced sensory sensitivities. Often there's a hypersensitivity or oversensitivity to the environment. But they may also sensory seek specific stimulatory input. There may be enhanced difficulties with the ability to plan, sequence events, and prioritise. And they may be particularly vulnerable to poor mental health, anxiety, and depression. Rejection-sensitive dysphoria is quite common. Rejection-sensitive dysphoria is where someone experiences really strong emotional reactions to real or perceived rejection. Some people have described this as an immense emotional pain from real or perceived failure to meet other people's expectations. Rejection-sensitive dysphoria, it's thought, occurs because of the differences in neurodivergent brains and a difficulty regulating internal communication to be able to regulate emotional responses. So those strong emotional reactions, they can be internalized and result in feelings of low self-esteem and harsh self-criticism, or they can be externalized. Somebody may respond with anger or burst into tears. So what can you do to help? First of all, acknowledge how debilitating RSD can be for the person. Next, identify what triggers those strong emotions such as crying, anger, despair, and feelings of rejection. Next, support by anticipating triggers, introducing feedback slowly and at supportive times of the day in safe spaces for the person. Ask the person what's the best time and situation for them to feel safe. And finally, encourage the person. Ask them for clarification when they sense feelings of rejection, but be careful to provide time for them to recover from their intense emotional feelings before trying to talk it through. So, here we have some simple, common adjustments that tend to work well for many people with autism and ADHD. First of all, break larger activities or tasks down and just provide one or two activities in the order that they need to be done at a time. Provide structure and times for that person to work very creatively, where they can document their ideas for development later. Practice body doubling. This is where another person does a task alongside you, and that can be in a real or a virtual environment. Provide more regular check-ins, perhaps false deadlines with agreement from the person, and review those for effectiveness. Really do consider lists, visual planners, and checklists of tasks. And normalise stimming in all your environments and settings. You can find more free downloadable resources on our website at www.authentic.uk.